From early caveman times to modern day, women have been going through birth naturally without the medication for pain. Natural childbirth means no pain medications like epidurals or spinal taps. A medicated birth includes those pain relievers. Most natural births give power to the mom. According to Baby Center Medical, being in charge helped lessen the pain, no loss of sensation to the mother, and they were able to move freely and be comfortable. This gives women a strong feeling of empowerment while in labor and a sense of accomplishment after birth because they are able to overcome such a difficult task. With no use of drugs, without the epidurals or other drugs given to the mom, natural childbirth removes the dangers of possible toxics going into the baby's body system. Some cases where anesthesia has been used harms the baby and mother. However, with natural childbirth, nothing will be going into the baby. While epidurals relieve the pain, natural childbirth is still faster. With the use of an epidural, it prevents the mother from feeling. With natural birth, she can feel whether she needs to push harder and when the baby is ready to come. Pushes are more effective with a natural childbirth also. This makes the hospital stays shorter, which makes the bills not as expensive, and it gives the mother a stronger connection to the baby because she is awake and alert as the baby is born.
Yeah. Okay, so I'm here today to present the con case saying that it is better to have an epidural rather than go through a natural childbirth. The first contention that I have today is that epidurals are actually very, very safe. An epidural is a small catheter inserted into the back, and when it's inserted, very little of the medication that is used to numb from the abdominal muscles down actually goes to the baby, according to bidmedicalcenter.org. Now, epidurals are actually safer than before the 1980s because those methods of pain relief actually knocked the mother out and provided serious health. I don't know what I'm talking about. Nowadays, when you go into the hospital to have a baby, most parents will choose to have an epidural. Now, my opponent here has made the case that epidurals should not be used when going into childbirth and that a natural childbirth is safer and better for the baby. I'd like to say that epidurals are actually a better choice than going in and having a natural childbirth for the following reasons. First, epidurals are actually very safe, much safer than most of the methods we have actually used in previous times. Second, most women are not in the going into labor for the experience of labor. They're in it to have a baby, the end result. And third, a good number of mothers do not have the pain tolerance required to go through a natural childbirth. Looking back at my first contention, that epidurals are actually very safe. When an epidural is inserted, very little of the medication actually goes into the baby. The Center for Disease Control and the World Health Organization say that the amount of medicine that actually goes into the baby is negligible and does very little damage to the baby. The actual harm that can come to the baby is when the epidural is inserted incorrectly. Second, most mothers are not in it for the experience. The connection to the baby that my opponent has mentioned previously can be had with the baby without the pain. The mothers are not required to have the pain in order to get that connection to the baby. They don't need to sit there and go through the pain of labor. They just need the child in the end. And third, those mothers who do not have the pain tolerance to actually sit there and go through a natural childbirth without the pain medication can pass out and endanger the child's life. When the mother passes out, the baby's breathing can be affected and a good number of other vital signs can be affected. Now, to look at my opponent's case, her first contention was that when you do a natural childbirth, it empowers the mother. But I'd like to say that you aren't always empowering the mother by going through this. They're going through unnecessary amounts of pain for very little gain. The connection that you have with your child is going to come with or without the pain. Looking at her second contention, the possibility of harm, that possibility of having, when you have a natural childbirth, there's actually a 3 times higher rate of prenatal harm than when you have it in a hospital with that epidural. So even though this is a very, very tiny amount, it is still actually safer to have it with the epidural in the hospital than to have it with a natural childbirth. And third, although a lot of studies have shown that, she said that it is faster when you have a natural childbirth, a lot of studies have shown that this is not always the case. And according to Elise Lieberman, medical doctor at the Scientist for Birmingham and Women's Hospital in Boston, says it is actually very close, and it is almost too close to say whether or not the epidural slows down the birth process or not. Thank you.
Okay, as my opponent just said, he explained that epidurals are safe, giving very little harm to the baby. Most mothers are not in it for the experience, and they still would be connected to the baby with or without the pain. And pain tolerance, if it's not high enough to go through the natural labor, it could also endanger the child. However, with the use of an epidural, instruments and tools like forceps and vacuum extractors are often used, leaving the baby with swelling and bruising on the head, which could potentially harm their skull or even give brain damage. Studies show that babies who are given labor through epidurals are more emotional, and they lack the breastfeeding skills that should be necessary. With an epidural, you'll also be groggy and not fully aware, therefore you would not exactly be able to hold him or her right away, and you wouldn't be able to get the mother's first touch of the baby until after the sedatives have kind of worn off. Now, like I said earlier, natural childbirth heightens the baby's alertness because the baby arrives much more aware of their surroundings compared to ones used with epidurals. Babies through natural childbirth are also more connected to the mothers and vice versa because they get that mother's first touch. The mother feels the power of giving birth to the baby without the pain medication that most mothers do think they need. And it also gives the mother a sense of accomplishment because they were able to overcome such a difficult task.
Alright, and with my final chunk of time here, I'm going to first try and look at my opponent's case and attack it, and then I'll come back to my own case and try and rebuild it if time allows. So, my opponent stated that when you use an epidural, it's more likely that instruments are going to be used in the removal of the baby, whether this comes in the form of having a C-section or if they use forceps to pull the baby out. Now, I looked it up, and the percentage of time that this actually happens is less than 10%. So looking at all epidurals as a whole, the total amount of times that instruments are used in this is very small and very negligible. Also, she stated that when the mother is on the epidural, she is mostly groggy and not aware when the child comes out. So when she has the first touch with the child after delivery, it won't be as good as with a natural childbirth. Looking at that, the epidural does not always make the mother groggy. It is only in very rare cases that it actually affects the entire mother. Normally, the epidural is only used to numb every sensation from the abdomen and lower. So going back to my own case on why epidurals are actually better than natural childbirth. First, these epidurals are actually very safe. Compared to a natural childbirth, they are actually 3 times safer as it can protect the mother from the immense amounts of pain, especially if they have a low tolerance, and they won't pass out and harm the baby. They also provide very little prenatal concern for a new mother, and according to the Center for Disease Control again, have very low chance of actually harming the baby. My second contention was that most parents, most new mothers, are not in it for the experience of labor and all of that pain. they will still get the connection with the child even if they don't experience that pain. And last but not least, if a mother has a very low pain tolerance level, they need that epidural to make it through the labor and not harm the child in the end. So again, we can only see that epidurals are actually safer than natural childbirth. Thank you for your time.